A new wave of COVID-19 is sweeping across New South Wales and Victoria. Western Australia has recorded its highest COVID-related hospitalisations since winter. The surge in cases has been linked to a new Omicron subvariant called JN1, which the World Health Organization has classified as a variant of interest due to its rapidly increasing spread globally. Well, infectious disease expert Paul Griffin is here now. Paul, how bad is this subvariant? How concerned should we be?
Look, we've certainly seen JN1 take over and become dominant, and by some measures, it's been the second highest peak of activity we've seen from COVID, other than the first Omicron wave. There's been some early reports of increased severity, but they haven't been proven, and a bit of discussion around more gastrointestinal symptoms. But, you know, what we know is this virus has changed many times. This is just yet another change, and when the virus changes, our immunity, our protection from vaccination or past infection declines, and that can allow a wave of transmission to happen like we're seeing now. But it does seem like these waves are having a lower and lower impact. We are seeing fewer people relative to the activity end up in hospital and not survive. But that's partly because of our tools, our vaccines, our antivirals. So perhaps the biggest thing we should be concerned about is complacency. If we don't keep using those things well, then the impact of this virus is going to remain higher than it should be.
Well, just on that, does the current vaccine protect us from this latest variant?
Yeah, it absolutely does, and there's increasing evidence provides really good protection, in fact, from hospitalisation and severe disease in particular. But at the moment, the rate is clearly too low. So the vaccine's going to do absolutely nothing in fridges. And so, again, that comes back to that complacency, and what we really need to do is get that awareness out there so we get our vaccination rates up. And, you know, many people say, well, I've had 2 or 3, I'm not going to get any more. But we know that these vaccines don't provide lifelong protection, and the virus keeps changing, as I say. So we need people to update those vaccines accordingly.
Paul, you say there's a danger in complacency, but is conversely there not also the fact that this is a drum that's been beaten so hard that people are like kind of over it?
Oh, absolutely. We've asked a lot of people over the course of this pandemic, and for many people, most people in fact, the impact of some of these restrictions has been very significant. But I think what we need to do now is just get back to some common sense messaging, not the doom and gloom that perhaps we heard at the start, but just let people know, as we're seeing right now, this virus isn't going to go away. If we are complacent and don't use all of our available tools, the impact will be far greater than it need be. So we just want some simple common sense approaches so that we do minimise the impact, keep people out of hospital, and make sure as few people as possible don't survive this infection.
Paul, thanks for your time tonight.
Thank you.